How does cholesterol affect your body? High cholesterol levels do not usually cause any obvious symptoms. As a result, people are often not aware that they have high cholesterol until a screening test shows abnormal results. High cholesterol levels can have harmful effects on the body, but people can take steps to lower them. In some cases, doctors may also prescribe medications. Keep watching to learn about the effects of high cholesterol. Normal ranges. Doctors will generally categorize a person's total cholesterol according to these ranges. Less than 200 milligrams per deciliter, it is desirable. 200 to 239 milligrams per deciliter, borderline high. 240 milligrams per deciliter and above, it is high. The optimal levels of LDL cholesterol are less than 100 milligrams per deciliter, while HDL cholesterol levels should ideally be 60 milligrams per deciliter or higher. Symptoms of high cholesterol. According to the National Heart, Lung and Blood Institute, high levels of LDL cholesterol usually do not cause symptoms. As a result, individuals are often unaware of the high levels until they get their results from a cholesterol screening. However, the National Heart, Lung and Blood Institute note that some people with very high levels may experience grayish white rings around the corneas in their eyes or fatty bumps on their skin. The Centers for Disease Control and Prevention state that about 38% of people in the United States have high cholesterol, so it is important to have a screening periodically. The diagnosis and treatment of this condition can help prevent serious problems. Effects of high cholesterol. Over time, high cholesterol may lead to the development of atherosclerosis. Note the National Heart, Lung and Blood Institute. In this condition, plaque accumulates in blood vessels throughout the body. Once the plaque buildup obstructs blood flow, it can lead to the following: heart attack, stroke, chest pain, reduced blood flow to the legs and feet. A 2014 study found that high cholesterol and high blood pressure may work together to contribute to the development of coronary heart disease. The authors reported that people with the highest cholesterol and blood pressure levels had the greatest risk of death from the condition. How does cholesterol affect the body? Having the correct cholesterol levels helps to maintain the right levels of vitamin D and hormones in the body and aids digestion. Cholesterol is found in foods such as meat, poultry and full-fat dairy products. People who eat animal products may have more cholesterol in their bodies at any given time than those who don't. The liver will also increase cholesterol levels when a diet is high in fat and trans fats. Having an increased amount of LDL cholesterol caused by trans and saturated fats increases the risk for heart disease and diabetes. LDL cholesterol coats arteries and causes a buildup of a substance called plaque on their walls. This leads to a condition known as atherosclerosis, which is a form of heart disease. Both the body and heart are affected when this happens. The condition slows down the blood flow to the heart muscle and can block blood from even getting to the heart. This increases a person's risk of heart attack. Tips for managing cholesterol levels. Cholesterol ratios, good or bad, can be maintained or altered. If a person has a cholesterol ratio that suggests a high level of LDL, there are ways to lower this level of bad cholesterol. Some of these ways include diet. Foods that are high in saturated fat, trans fat and carbohydrates raise cholesterol levels, so eating less of these types of foods will help manage and reduce it. Weight. Many risks are associated with being overweight or obese, including increased cholesterol levels. Keeping a healthy weight helps all factors of health as well as reducing the risk of heart disease. Exercise. Being active for at least 30 minutes per day raises the heart rate, helps with keeping a healthy weight, and reduces LDL cholesterol levels while increasing HDL cholesterol levels. In addition to these lifestyle methods, a doctor can prescribe medications to help lower a person's cholesterol levels. The two most popular medications are statins and niacin. Both are used to reduce LDL cholesterol levels. Statins come in high, moderate and low doses, depending on an individual's needs. Studies show that statins may decrease LDL by 60% and can also increase HDL production. If statins are not a useful medication because of other drugs a person may be taking, cholesterol absorption inhibitors may be a good alternative. The best way to maintain a normal cholesterol ratio, however, is by taking care of the body with a healthful diet and moderate exercise every day.